There's been a trend, I would say, over the past 10 to 20 years of physicians becoming aligned with health systems. My goal is always to bring as much alignment as possible. I think the overlap of objectives and goals and outcomes is there 90% of the time. Physicians are very competitive, and so when they see data and they see themselves compared to others, it spurs them into action.
Dr. Andy Anderson is Chief Medical Officer and Chief Quality Officer, RWJBarnabas Health. He has experience and expertise delivering outcomes in integrated health systems through implementation of large-scale initiatives, leveraging innovation and effectively managing change. Dr. Anderson holds an MBA from Marquette University, and his MD is from University of North Carolina.
It creates energy, it creates accountability, it helps us to deliver better outcomes when our board is engaged and tracking these outcomes with us.
RWJBarnabas Health is a $6 billion revenue company serving approximately 2/3 of the population of New Jersey, and it maintains a very strong partnership with Rutgers University. Dr. Anderson says that achieving healthier communities through delivering great care is the main focus of RWJBarnabas.
So having the integrated, coordinated, connected system of care is the ultimate model that's going to work best for patients.
If you enjoy this discussion, remember to subscribe to the show. Now, let's join the conversation as Dr. Anderson emphasizes the importance of integrated care.
Well, good morning, Andy, and welcome.
Thank you, Gary. Good morning.
We're pleased to have you at this microphone. You've been a highly successful physician executive for now 25 years or so. What did the young Andy think about leadership?
The young Andy thought leadership was extremely important and really looked at role models as I was in college and in medical school and looking for leadership and trying to identify the characteristics of effective leaders. And I think there's a tremendous amount of learning that comes from following other leaders, understanding things they do well, understanding things they didn't do well, and learning from it.
When did you first become interested in medicine, Andy?
Yeah, I was always a science and math kid. And then in college, as I volunteered at a hospital and really saw how patients can be helped in the healthcare setting, and then behind that, the problem solving and the science behind it was fascinating and really drew me into the field when I was in college.
Are you still seeing patients?
I am. I'm a general internist by training. Worked as a hospitalist for many years and currently continue as a primary care physician. I work in a resident clinic and I'm seeing more urgent care type patients and teaching our residents at the same time. I very much enjoy that. It keeps me engaged and happy and helps me understand what's happening at the front lines.
Well, you're both practicing and leading. What brings you joy in your work, Andy?
I love seeing patients do well, and that cuts across their experience, their quality outcomes, and the safety culture that we all are trying to achieve. And having those great outcomes and seeing our team members deliver those great outcomes, that's where the joy is. And knowing that we can continue to do that better and better, that's part of the inspiration that brings me to work every day.
Well, you're now Chief Medical Officer and Chief Quality Officer at RWJBarnabas. Can you describe RWJBarnabas for us, please, Andy?
Yeah, absolutely. RWJBarnabas is the largest integrated academic health system in New Jersey. We're a $6 billion revenue company and serve about 2/3 of the population in New Jersey. And provide the continuum of care from our hospital setting to our ambulatory footprint. We are very focused on delivering those great outcomes. Also have really spent a lot of time trying to understand our communities and looking at social determinants, looking at diversity, equity, and inclusion, and trying to help our communities be healthier. So our mission is to achieve healthier communities. And we believe we're doing that through delivering great care as well as through prevention and promoting health.
So, as the Chief Medical Officer and Chief Quality Officer, what are your responsibilities, Andy?
I'm responsible for those outcomes and the focus on our quality, our safety, and our patient experience. And that encompasses our entire platform of services. I'm also responsible for our academic mission. We have a very strong partnership with Rutgers, and that crosses our graduate medical education programs, our medical student, nursing programs, physician assistant, and the whole allied health professional field. Rutgers is really our pipeline. And then additionally, our research mission, trying to deliver the best possible care, the latest and greatest with technology, incorporating evidence-based medicine into our practice. I also have oversight of our laboratory and pathology service line, and then our population health infrastructure, as we truly do try to keep our communities healthier.
Well, the obvious question, Andy, is what do you do with your spare time?
Well, for me, having time with family is the very most important. My wife and our three kids, we enjoy time together. We enjoy traveling. We enjoy watching movies. So having that time to disengage is very important, and I look forward to that every day and every weekend.
How did the care delivery team at RWJBarnabas kind of fare during all the COVID activities?
We were with the early wave in March, April of 2020, and we had many of our employees suffer and some died, and so there was quite a bit of challenge, I would say, in the beginning to get organized around our COVID response, but we did, and we were able to be innovative, and we were able to do things much more quickly than we ever thought we would. We stood up a telemedicine platform, and we're doing 10,000 visits a week over the course of less than a month. We were able to accomplish that.
Well, how about the medical staff in particular? How did the physicians fare during COVID?
Yeah, the physicians really stepped up and helped tremendously. We had physicians who were doing work that they normally wouldn't do. For example, we had physicians normally who would spend the majority of their time in the outpatient setting coming into the hospital to help take care of patients. So it was amazing to see the physicians really step into it. We purposely tried to make sure that we were supporting, recognizing, reaching out to our physicians because it was a tough time. And we continue to have some element of surges in infectious diseases. And if anything, I think it has built some great resilience and some systemness and people helping each other out where maybe they wouldn't have done that before. So it created a network of relationships of our physicians that really strengthened us as a health system.
Let's turn to specifically leading physicians. Could you share with us what's the history of physicians being employed by health systems or large hospitals and health systems?
Yeah, there's been a trend, I would say, over the past 10 to 20 years of physicians becoming aligned with health systems. The days of putting up a shingle and having your private practice by yourself those days are behind us. COVID brought some of that out. It became economically challenging to sort of survive as an independent practitioner, and having yourself really tied into a health system was value added. And I think that is the trend that we'll continue to see. And I do think it helps bring that coordinated, integrated care to patients.
Mm-hmm. Is that different orientation in terms of, let's say, being employed at a health system versus in private practice? Do you think that influences the type of person that wants to become a physician and go to medical school?
I think the underlying motivation is as it has been, and it is to help people. I mean, being a physician being in healthcare, it's a noble profession, and we're all after the same thing, and that's to make people better, and to keep people well. So I think the motivation continues. I think integrated health systems are a better way to have that coordinated integrated care so that physicians and nurses and other health professionals can truly see their patient being cared for by a comprehensive team of experts. And with the patient at the center of that, it creates the best outcomes. I think, if anything, the movement of healthcare to become more organized around systems of care is going to be very motivating, and it's going to draw more people into the field.
Yeah, that's good to hear. This is a general question, Andy, as opposed to specific to RWJBarnabas, but what's the difference in role between a chief medical officer and, let's say, the president of the medical staff?
The president of the medical staff and the CMO of a hospital, as an example, are very close partners in trying to, for one, make it easier for physicians to do the work that they do, and to provide the support needed in the hospital and or in the ambulatory setting to be able to do that. So, tackling issues together, I think, is what we're all after, and trying to solve them, so that we can help our fellow physicians is what the goal is.
Would it be fair to say that the chief medical officer is more focused on delivery in the hospital and the president of the medical staff is more focused on just delivery in general terms? Is that fair or not, Andy?
I think the lines are blurred appropriately. And, I do think the chief medical officer role is quite important, in terms of delivering the care, making sure the outcomes are where they need to be. And then the other place I'll pull in here is the partnership with the rest of the team in the hospital. So the CMO in particular must be a close partner with the chief nursing officer, the chief operating officer, the CEO of the hospital, and the support services, in the hospital themselves. The medical staff president, in many ways, is the representative, for the physicians and the voice of the physicians. But my goal is always to bring as much alignment as possible. I think the overlap of objectives and goals and outcomes is there 90% of the time. And if we all can row in the same direction together, as I've seen happen in my system and in other systems, the outcomes are truly powerful.
Let's turn to data for a moment. And the electronic medical record is a core source of data. How is your job in terms of quality and measuring quality and outcomes? How's that evolved, and as the EMR has evolved?
Yeah, I think we've all seen the EMR as the ultimate solution, but we haven't quite gotten there yet, and
Yeah.
and we continue to see it get better and better, and part of what we're after is real time data, and so as we look at things like Leapfrog, CMS Stars, US News, the data that goes into those numbers and grades, is old data. And so in some ways you're looking at the past, and what we need is looking real time at what's happening right in front of us. And so the EMR ideally is going to be the source of that data, real time. And again, it's gotten better. But I think what I've been pushing at is trying to make sure we get physician level real time data, so that physicians can truly know how they're doing and compare themselves to others in their field. And then also, I'll call it unit level data. For example, a hospital floor, that operating unit within a hospital should have real time data. How are they doing? Has there been a pressure ulcer? Has there been a central line infection? Those things, again, we're getting better and better at tracking them, but I think there's still room for improvement. Data is extraordinarily important. It provides transparency. It provides benchmarking. It really can be motivating. Physicians are very competitive, and so when they see data and they see themselves compared to others, it spurs them into action, which is a good thing.
There's been a lot of criticism through the years about the number of quality measures, and there's just too many of them, and the amount of time and energy to collect data for them exceeds any value. How would you think about that, Andy?
I would agree. There are too many, and I think about that every day in terms of how to simplify. And so, part of what I'm trying to do is to focus on those elements that are the most important elements. So, for example, HCAHPS, our patient satisfaction survey data, for us, it applies to Leapfrog, CMS Stars, US News, paper performance, and of course, it's the right thing to do for our patients and families. And so pulling out, HCAHPS as a focal point for our health system has been part of my role. There are other elements of quality that are also impactful, like mortality. That's the ultimate outcome. And so HCAHPS and mortality are two areas that our health system is hyper focused on to make sure that we improve.
So RWJBarnabas is an academic medical center. Certain health systems aren't necessarily affiliated with an academic institution. Is there greater kind of quality requirements because you're an academic medical center or not?
Well, the grading, if you will, from CMS Stars, US News, and Leapfrog, looks at objective criteria no matter what type of hospital you are. And so in many ways, for an academic medical center, where you tend to have more complicated patients, that does make it even more of a challenge. And the response is that we staff to that. We make sure that we have the expertise, the technology, the support structure to be able to care for those patients and get those great outcomes. Our health system is a mix of community-based hospitals and academic-based hospitals. And part of our overall fabric is to spread the teaching and research mission generally across the system. And if anything, over time, I think we'll look more alike than we look different as we deliver standard best practice care.
Yeah. How about the board of directors? Is the board intimately familiar with the quality data and trends that you're running into in terms of quality data?
We've made an effort to be sure that they are. And some of our board members are very articulate, very skilled in quality and safety, which for us is very helpful. It actually is a blessing, if you will, for the board to pay attention, to call it out as one of our core areas of focus. It creates energy, it creates accountability, it helps us to deliver better outcomes when our board is engaged and tracking these outcomes with us. So I value that, I welcome that. Transparency for me is a powerful motivator. It makes us all get better.
One of the major trends we're seeing now is that large big cap companies like CVS and Walgreens and Walmart and Optum and now Amazon are elbowing their way into primary care. At least they're trying to elbow their way in. What do you think about that trend, Andy?
The last thing we want to do is fragment care. So having the integrated, coordinated, connected system of care is the ultimate model that's going to work best for a patient. So to your question, I am concerned about fragmenting care. There's a role for things like urgent care for problems that can be fixed quickly. But in the management of chronic disease and in the promotion of health, having that integrated system around you, I think is extraordinarily important.
Yeah. Some of those companies are actually buying or employing physicians, either individually or acquiring groups of physicians. Do you see that trend picking up steam or continuing, Andy, or is that kind of a short-term trend that will lose its steam over time?
As this evolves, I think that primary care network is going to have to interconnect with the specialty care network, with the hospital setting, with the ambulatory surgery setting. So it'll be interesting to see how that plays out over time. I do think the ultimate winner in the healthcare sort of game will be the integrated health system. I think that is the best model for providing patient-centered care and to achieve those best outcomes. So I do think over time we will see more of that sort of large integrated health system network as being the place of choice for our patients.
Well, let's turn to innovation in medical care, and particularly the term precision medicine, which has been around for a while and probably hasn't lived up to what people had hoped, but seems to be gaining steam here as we have more data and more precise data and other technologies. How do you view precision medicine, Andy? Where are we today relative to maybe its promise?
Well, I remember learning about precision medicine in medical school 30 years ago. So we've certainly been, speaking about it for quite some time. And I do think we've made quite a few advances as a healthcare institution in our country. And we've gotten better in areas such as cancer and making sure that we know which chemotherapy drug is going to work for which particular patient, depending on their genetic profile. The challenge is the cost of sort of personalizing medicine it's a big cost, and so we want to make sure that there's availability across all of our citizens in this country for the therapies that are going to work. And so over time, the costs tend to come down as some of the therapies get commoditized. So I think it'll be an evolution that'll take years to play out. But I do think that is where we have to go. We have to make sure that as an individual, you're getting the best possible treatment depending on who you are and what your genetic profile looks like.
Andy, this has been a terrific interview, as we expected, by the way. I have two final questions, wrap-up type questions. The first one is, what advice do you give people that approach you that might be interested in medicine and they're trying to sort out whether they do want to go to medical school or nursing school, perhaps? What advice do you give someone like that?
Well, I encourage individuals to go into healthcare. When I think about it from the professional level, I often will see medical students who are eager to move into, I'll call it the business of medicine. And my advice always is become a great doctor first. Become a great nurse first. Make sure you're clinically competent, that you're able to deliver the best possible care in your field. And that enables you to be a better decision maker in the business of medicine. As a leader, you have more credibility, you have more knowledge, more experience, and you're able to make change as a leader in the long run. So becoming an excellent individual in your trade really is step one that everyone needs to do.
The second and the final question in this category is, what advice do you give to healthcare leaders, be they a physician or not a physician, that are interested in becoming more involved in health system leadership? What advice would you give kind of an early up-and-comer?
I'll go back to where we started and really encourage everyone to find great mentors. And there are many mentors out there who would love to be teachers, coaches, really trying to help develop the next generation of leaders. And you can learn so much by following and learning from great leaders. Secondly is reading voraciously, trying to make sure that you understand the field of play and the different elements that are happening across the healthcare industry. The more knowledge you have, the more likely you're going to be able to apply that knowledge as an effective leader. And then thirdly is understanding the different fields and not thinking of your own field in a silo. So as I mentioned before, partnering with nursing, social work, physical therapy, dietitian, etc., trying to truly understand those different fields and how they all interconnect and really come back to the patient, and trying to make sure the patient is getting that comprehensive array of services that they need for their health and their healthcare.
Great advice, Andy. Thank you for your time today. Terrific interview.
Thank you, Gary.